World Alzheimer's Day, September 21, 2015. Every year since 1994, Alzheimer organizations have observed World Alzheimer's Day on 21 September. Alzheimer's organizations around the world are concentrating their efforts on raising awareness about Alzheimer's and dementia on World Alzheimer's Day. The theme this year is Remember Me. Every 68 seconds someone develops Alzheimer's disease. Alzheimer's disease is the most common form of dementia, a group of disorders that impairs mental functioning. Alzheimer's disease is often called a family disease, because the chronic stress of watching a loved one slowly decline affects everyone. The disease was named after neurologist Alois Alzheimer, a German psychiatrist. In 1906, Dr. Alzheimer noticed changes in the brain tissue of a 51-year-old woman who had died of an unusual mental illness from progressive course of dementia. Her symptoms included memory loss, language problems, and unpredictable behavior. After she died, he examined her brain and found many abnormal clumps, now called amyloid plaques, and tangled bundles of fibers, now called neurofibrillary, or tau tangles. Alzheimer's disease is an irreversible, progressive mental deterioration that slowly destroys memory and thinking skills, and eventually the ability to carry out the simplest tasks. This is due to generalized degeneration of the brain. Occur in middle or old age, and is the most common cause of premature senility. Alzheimer's disease is ranked as the 6th leading cause of death, just behind heart disease and cancer, as a cause of death for older people. Risk factors associated with Alzheimer's disease. The disorder mainly affects older people, and a greater proportion of over 85-year-olds have it than of over 65. Family history or inheritance of genes having Alzheimer's in the family is associated with higher risk. This is the second biggest risk factor after age. Having a certain gene, the apolipoprotein E or APO gene, puts a person, depending on their specific genetics, at 3 to 8 times more risk than a person without the gene. Some studies have indicated that as many as 40% of patients have a family history of dementia of Alzheimer's type, and it has shown linkage to chromosomes 1, 14, and 21. Being a female, women are more affected than men. Factors that increase the vascular risk including diabetes, high cholesterol, and high blood pressure. These also increase the risk of stroke, which itself can lead to another type of dementia. Low educational and occupational attainment. Prior head injury. Neuropathology in Alzheimer's disease. In Alzheimer's, there are microscopic senile plaques and neurofibrillary tangles between and within brain cells. The damage initially appears to take place in the hippocampus, the part of the brain essential in forming memories. As more neurons die, additional parts of the brain are affected, and they begin to shrink. By the final stage of Alzheimer's, damage is widespread, and brain tissue has shrunk significantly. The classic observation of a brain from a patient with Alzheimer's disease shows diffuse atrophy and enlarged cerebral ventricles. Common symptoms of Alzheimer's disease. Worsened ability to remember new information. Misplacing personal belongings. Forgetting events or appointments. Getting lost on a familiar route. Impairments to reasoning, complex tasking, exercising judgment. Poor understanding of safety risks. Inability to manage finances. Poor decision-making ability. Inability to plan complex or sequential activities. Impaired visuospatial abilities. Inability to recognize faces or common objects or to find objects in direct view. Inability to operate simple implements, or improper wearing of clothing to the body. Impaired speaking, reading and writing. Difficulty in using of common words while speaking. Hesitations, speech, spelling, and writing errors. Changes in personality and behavior. Out of character mood changes, including agitation, less interest, motivation or initiative, apathy, social withdrawal, loss of empathy, compulsive, obsessive or socially unacceptable behavior. Mild Alzheimer's disease. As Alzheimer's disease progresses, people experience greater memory loss and other cognitive difficulties. Problems can include wandering and getting lost, trouble handling money and paying bills, repeating questions, taking longer to complete normal daily tasks, and personality and behavior changes. People are often diagnosed in this stage. Moderate Alzheimer's disease. Memory loss and confusion grow worse, and people begin to have problems recognizing family and friends. They may be unable to learn new things, carry out multi-step tasks such as getting dressed, or cope with new situations. In addition, people at this stage may have hallucinations, delusions, and paranoia and may behave impulsively. Severe Alzheimer's disease. People with severe Alzheimer's cannot communicate and are completely dependent on others for their care. Near the end, the person may be in bed most or all of the time as the body shuts down. Alzheimer's disease is not simple to diagnose, there is no single test for it. Diagnosed by excluding other causes for dementia. Management of Alzheimer's disease is mainly psychosocial therapy. Patients often benefit from a supportive and educational psychotherapy in which the nature and course of their illness are clearly explained. Psychodynamic interventions with family members of patients with the illness. Drugs like cholinesterase inhibitors are useful in treating mild to moderate cognitive impairment. The most important step in the management is to identify a continuous caregiver and to give nursing care till the fullest lifespan end. To listen to Remember Me, thank you.